Now, you would be moving on with the physical evaluation of the individual. Now, it starts right away when the patient walks into your clinic and you're looking even at the way the person is walking or talking and telling you about his or her presenting illness and what are the chief complaints and recalling how the complaints develop. Now, the orientation in time, space, and person is again very important. And this is how you're going to assess the individual. It's not going to be just the documentation of those signs and symptoms. It is going to be an overall aura that is surrounding the patient. How well oriented he or she is in time, space, and person. There are different evaluation techniques. For instance, you can resort to the mini mental state examination or other scoring systems, and they're quite helpful in diagnosing the kind of orientation the person has, what kind of a memory loss he or she is suffering from. This is very important. So this kind of an evaluation is how you're going to move on, and the ultimate goal is to basically dig out the underlying condition which is resulting in the memory loss and the cognitive impairment, the motor disabilities in the individual. So starting off with the key points in the history. The mode of onset, whatever the signs and symptoms are, if it's focusing on the memory or the motor complexes or the cognitive behavioral changes, whatever the signs and symptoms are, you're going to see what are the associated symptoms and how did they develop. Whether it was a gradual onset or whether it was a steep onset in the individual. If it's acute onset of the development of signs and symptoms, maybe it's the mimicking the condition of Alzheimer's disease. On the other hand, the vascular disorders usually have a gradual onset. People suffering from underlying conditions, for instance, hypertension or chronic conditions such as diabetes mellitus, usually develop this set of signs and symptoms over a period of time. So you would be looking at all of these features in the individual, and then we have the course of progression, again, classifying it as an acute or chronic disease that you're dealing in with. Then the pattern of cognitive impairment is also seen in the individual. What is the thought process, and whether you can use the terms such as thought block, a flight of ideas, flight of speech, and all of these are basically relating to a thought disorder in the individual. Sometimes there is a presence of non-cognitive symptoms as well. The thought processes are fine. The patient is not even suffering from any kind of hallucinations, delusions, or any kind of these cognitive disorders. Rather, there is the presence of the non-cognitive symptoms that the patient has. Then we have the nutritional statuses, because as I've already mentioned, vitamin deficiencies can even sometimes result in the deterioration of the memory, and overall cognitive disability is enhanced in such individuals. Drug and family history is also emphasized upon. Genetics play a key role, and that is why you'd be focusing on any kind of family history that the patient has, close relatives, siblings, parents, either they had been suffering from some kind of, or they had any kind of a history of memory loss or not. Drug history, because as we noted down, the etiological factors also consisted of alcoholism and heavy metal poisoning as well. Now you would move on to the physical examination, and it obviously starts off with the general physical examination. The overall mobility is also tested for. The balance is assessed when the patient walks in. The gait of the individual is looked for. Then you would be focusing on the focal neurological deficits. And this is basically when you carry out the complete cranial nerve examination along with the examination of the reflexes in the individual as well. The extrapyramidal signs are noted down, and you'd be looking for basically the typical signs. For instance, Babinski's sign is one of the reflexes. The plantar reflexes are again highlighted over here, and if there is any abnormality that is noted down, for instance, clonus is one of the feature which is a sign of the extrapyramidal features that are noted down for these patients. Now, usually patients who are suffering from vision or hearing loss, and it is associated with the memory loss, they're usually suffering from the underlying dementia. So this is again a very important key feature. You would be examining a complete ophthalmological examination is carried out for the individual. Hearing tests are carried out, and you would be looking for the screening of the vision and hearing losses. Underlying conditions of heart, that is the cardiac abnormalities and pulmonary evaluations are carried out just to rule out any underlying disease which is resulting in the memory loss in the individual. So overall, the examination or the evaluation of the patient starts in when he or she walks into your clinic, and then you would be basically ruling out the causative factors, and you would have the differentials at your hand. And this is again very important because before you ask for the labs to be carried out, you must have ruled out some of the conditions, and you should have a list of differentials at your hand to work on and manage the patient.